We are back once again at Revive Med Spa in Kingston, this time with Dr. Richard Roth. Thank you for being here.
Well, thank you for coming. It's nice seeing you.
Yeah, great to have you. Let's talk a little bit about what you specialize in. It encapsulates a lot.
It does. So my practice is a surgical practice, and that practice involves surgery not only for correction of vision, but also for a correction of our eyelids or enhancement of our eyelids. And we do that here at Revive. So when we talk about laser vision correction, we do that here. When we talk about eyelid surgery, making our eyelids look a little rejuvenated or more youthful, making us feel more awake, more interactive, that's all done here at Revive Med Spa.
Amazing. Lots of opportunities right here in-house, which I think is really a huge selling point here. It's super convenient, and it can really change your attitude to your own appearance. I think a lot of people might be thinking about their eyes. You know, it's one of the first signs of aging, and they might be looking at a puffy under eye or a heavy lid. You have, procedures that can be done right here to fix that. Let's talk about some of those.
Sure. So when we talk about puffy eyelids, we have some different treatments. Some can be what you call non-invasive, and that's where we can either laser some of the skin to tighten it. And then we also have some surgical interventions, and that's where we may take a little skin, if we have a little roll of skin, or what we call hooding. Puffiness sometimes is the fat around the eyelids, which we want to reduce in size. And those things together can help rejuvenate and make our eyelids feel lighter and make us look more awake.
Absolutely. So let's talk about what goes into a procedure like this and perhaps the recovery time afterwards. What do people at home need to know?
Sure. So when we talk about our upper eyelids, we're typically talking about someone will come in, they'll say, I have a little hooding or my eyelids feel heavy. So in that case, the surgery is done here in the office. It takes between 45 minutes to an hour. Patients are very comfortable throughout. There is a little medicine we take by mouth to make us relax. The area is made numb. And then afterwards, we have some small little sutures that dissolve with time. And they go home that day, okay? The first 2 to 3 days, we call Dr. Ralph downtime, and that's where we're really asking them to follow a very regimen, some either cool compresses or maybe some goggles that we keep pressure on. But typically by day 4 or 5, we're starting to get back into our activities. You know, we can have a little black and blue and a little swelling.
Wow, it's all like a lot more convenient and easy. The procedure itself seems more convenient than I realized ever, so it's nice that it happens right here too. Before I let you go, who might be a good candidate for an eye surgery like this?
Well, it all depends because we're all a little different. So there's no one who I would say is specifically not a candidate. So it's really what your complaint is or what your concern is and what our techniques are and do they match, right? So really to get to someone's goal, sometimes it's not surgery and sometimes it's other non-invasive things that we have to offer. So it's really coming in for a consult, understanding what the concern is, and then putting together the correct treatment plan for that.
Amazing. There's so many options that all can be done here, even on the spa side of things. I think there's a lot that you can learn about Revive, and you can do that online, revivenepa.com, or just give the office a call to learn more. But Dr. Roth, thanks for this great overview.
Well, thanks for coming. It's great seeing you, and have a great holiday season.
You too.